Hello everyone, welcome to Helpful Hints for Chapter 23, Diseases of the Musculoskeletal System and Connective Tissue. First of all, please know that many codes in this chapter will pull in laterality, designations of whether we're talking about the right side or the left side. So be sure, as always, to check the tabular list with your diagnosis codes and make sure you're including all necessary characters. A few other terms to consider in this chapter are pathological fractures and stress fractures, and understanding that these types of fractures are different than traumatic fractures. We will spend quite a bit of time with traumatic fractures later in the semester when we discuss the injuries chapter, but let's just do a quick overview from this chapter just to touch base about the types of fractures. First of all, traumatic fracture. This is pretty self-explanatory, as a traumatic fracture is any fracture that results from an injury or trauma, whether that's a bicycle crash or a car crash, a tackle in football, falling from a tree. Anything that's injury related is a traumatic fracture. A pathological fracture, on the other hand, is caused by an underlying disease, right? Pertaining to, we know patho means disease. The bones have been weakened by some sort of disease, such as osteoporosis or even cancer. Sometimes pathological fractures may be called spontaneous fractures, as they happen just spontaneously. There might be a slight trauma involved that ordinarily would not result in a fracture, such as walking up the stairs, walking across the room, opening a window. So again, weakened by disease happens spontaneously. And then stress fractures are considered repetitive fractures. So these result from a repetitive force, such as marching or intense walking, running, or hiking. On the note of fractures, in the alphabetic index, please mark or highlight in some way to remind yourself that there are two main terms when it comes to fractures. We have fracture pathological and fracture traumatic, pathological and traumatic, but notice they are full main terms here, not subterms. So be careful when you're coding for fractures. Make sure you're looking within the correct main term. In regard to stress fractures, if you ever need to find a code for a stress fracture, those are actually found under the main term of fracture traumatic, but they're just listed as a subterm under fracture traumatic. So if you're ever looking for that, now you know where to go. This chapter also addresses joint replacement procedures, which are coded to the root operation of replacement. So let's remember the definition of replacement: putting in or on a biological or synthetic material that physically takes the place and or the function of all or a portion of a body part. So any joint replacements are coded to that root operation of replacement. So that's a pretty easy connection to make here with those procedures. When coding for hip and knee replacements, I want to draw your attention to the alphabetic index. So here we are under the main term of replacement with subterm joint, and then we have hip and knee also listed as subterms. If we have a total hip replacement or total knee replacement, you will come to the correct subterm, choose whether it is right or left side of the body, the right hip or the left hip. So notice here, for example, let's do a left total hip replacement, and this will lead us to table 0SRB. This is going to be our total table, 0SR with the fourth character of B. If a knee replacement or hip replacement is documented as partial, that just means only one of the weight-bearing surfaces is being replaced. So then that would tell us to go in one more level with our indentations here for a subterm. If we're doing again that hip replacement and it's not total, the documentation might say acetabular surface or femoral surface, so know that these are options here if the replacement is documented as partial. So same with the knee. If we have the left or the right, these will be our total tables here. 0SR for the left, it would be fourth character D. So again, total. And we'll go in one more level in the indentation to pick the correct surface if it's a partial knee replacement. So describing whether it was the femoral surface that was replaced or the tibial surface. Also, when you're coding hip and knee replacements, once you find the correct table in the tabular list, pay special attention to the 6th and 7th characters. They're a little more in-depth than what you're used to seeing. Let's take a look at an example from exercise 23.3. Here we have primary osteoarthritis of right hip, replacement procedure, replacement total of hip with ceramic bearing surface cemented. So let's begin with our diagnosis code. You should be getting pretty good at these by now, so I won't show you a picture from the book, but we would start with the main term osteoarthritis, subterm primary, subterm hip, which leads us to M16.1. We know to check the tabular list where we pull in that laterality on the 5th character. So M16.11 is our final diagnosis code. Now, we mentioned earlier that it's important to look for those laterality characters. So make sure that's on your radar screen. Now, moving on to the procedure, we start with our main term of replacement subterm joint, and we are replacing the right hip, right, and it says it's a total. So remember, we stay here, 0SR9. These would be used if it was partial and specified to the weight-bearing surface. But here our documentation says total. So we'll stay right here, 0SR9. And then, of course, we will go check the tables. Making sure we're in the correct table, replacement procedure, hip joint right. So we're okay through character 4 here. It's an open approach, that's our only option. It tells us that they're using a ceramic bearing surface, so that will be pulled in with character 6, synthetic substitute ceramic, 3, and then it says that the replacement is cemented in place. So that's pulled in with our qualifier character 7, and cemented is documented as character 9. So 0SR9039 is our final diagnosis code. Procedure code. Another procedure addressed in this chapter is spinal fusion. This is where 2 or more vertebrae are fused together to help address problems in the spine. So be sure to spend the appropriate amount of time reading through this section in the handbook because it gets pretty in-depth. But let's go ahead and code an example from exercise 23.4. Here we have cervical spondylosis, C5, C6, C6, C7. Then our procedure, anterior column cervical spinal fusion, C5, C6, C6, C7, open anterior approach with interbody device. This one sounds a little worse than it actually is. The procedure table walks you through it pretty well. But let's go ahead and start with our diagnosis code. We'll find the main term of spondylosis. Now, you'll see here, whenever we're dealing with issues of the spine or the back, often myelopathy and radiculopathy come into play. So you'll see that there are two big subterms here. With myelopathy, radiculopathy, and without myelopathy, radiculopathy. So in this case, there is no mention of those other two conditions. So we can go the without route. Then we'll go in one more indentation here to cervical region. We know it's the cervical region because it was documented up here as cervical, but also remember your abbreviations from medical terminology course. That C is referring to cervical vertebrae. So remember we had the T's for thoracic and L for lumbar, and here we have C for cervical spine. So our final code here for the diagnosis would be M47.812. For the procedure, we will start with our root operation term, which is fusion. Fusion is one of your 31 root operation terms from the medical surgical section that you should be familiar with in the appendix and back from week 3 in your video in your root operation chapter. Sorry, I digress, but root operation fusion. Anyway, for this procedure, we'll start with the main term of fusion. Again, we're talking about cervical vertebral, and then we're going to go in one more subterm for 2 or more. How do we know that it's 2 or more? Well, here we have the fusions C5, C6, so they're fusing between 5 and 6. And they're fusing between 6 and 7. So here we have one fusion, and here we have a second fusion. So between 5 and 6 and between 6 and 7. So this will lead us to 0RG, fourth character 2, cervical vertebral joints 2 or more. Then it tells us we have an open approach, 0. Then the device, they tell us, is an interbody fusion device, character A. And then we have anterior approach, anterior column. This leads us to the qualifier character of 0. So final code 0RG20A0. Let's take a look at another example, this time from exercise 23.4. Here we have acute osteomyelitis of left distal femur due to type 2 diabetes with diabetic arthropathy. Then we have our procedural statement here, sequestrectomy, percutaneous, and percutaneous excision of sinus tract, left distal femur. This one's kind of fun, as you may learn a few new medical terms. Remember, never ignore a medical term in the documentation that you may be unfamiliar with. Always do your homework. Sometimes it's okay to go out and Google a little bit to figure out the definition of a term. As a coder, it's always a wise idea to do a little personal research on your own if it's in order. So let's go ahead and start, as we usually do, with our diagnosis. Let's tackle the diabetes. Whenever I see a reference to diabetes in a diagnosis statement, I tend to start there. So let's go directly to our main term of diabetes, and here it's documented as type 2. Now here we're going to pull in an interesting subterm under the type 2 diabetes. So looking back up here again at our diagnosis statement, we have the acute osteomyelitis and it's telling us that it's due to the type 2 diabetes. So when we come to diabetes type 2, subterm with, we scroll down through here and you will find that there is no subterm for osteomyelitis, right? We have the type 2 diabetes. It's telling us that the osteomyelitis is due to that diabetes, but there's no subterm. So this is where we're going to pull in just a generic term right here, complication. So diabetes type 2 with complication, and then we're going to go down one more indentation level here to specified. It's specified as to what the complication is. It's the osteomyelitis. But that, again, is not listed as one of the main terms. So we're going to pull in E11.69, type 2 diabetes with a specified complication, which is the osteomyelitis. Now, as usual, we're always going to act. We're always going to go check the tabular list. So when we go check this out in the tabular list, we see an instructional note. Use additional code to identify the complication. We know the complication is the osteomyelitis. That's going to be coded down here with the M86 category code. Osteomyelitis, acute of the femur, left, leads us to code M86.152. So here with two codes, we've pulled in the osteomyelitis due to the type 2 diabetes. We also have diabetic arthropathy in our diagnosis statement. This actually is listed as a subterm. So diabetes type 2 with arthropathy, E11.618, and that's where we find this code. So these are the three diagnosis codes for this example. Now let's go ahead and take a look at our procedural statement here. We have two procedures documented, the first one being the sequestrectomy and the second one being the excision of the sinus tract. So let's first talk about sequestrectomy. We know that the suffix ectomy means a surgical removal. Well, a surgical removal of what? This word part does not look familiar to me. What does this mean? Well, here we're going to come up with the term sequestrum. So this is what I was referring to before. If you don't know the meaning of a term, go look it up. It helps you immensely. So when we do a little research, we find out that sequestrum is a piece of dead bone that is broken off, usually from sound, healthy surrounding bone. So let's think about this in terms of a root operation. Okay, we have this piece of broken off dead bone that has become detached from the healthy bone. When you look for sequestrectomy in the alphabetic index, you see the reference to C, extirpation, that root operation of extirpation. And we've talked about extirpation a few times this semester, but let's just review it one more time. What is extirpation and why are we using this root operation here? Well, the definition, remember to check it out in the appendix if you don't remember. Extirpation means taking or cutting out solid matter from a body part. So that solid matter can be anything. It can be a foreign body like a marble or a fish bone caught in your throat. But it can also include abnormal biological byproducts like gallstones or a thrombus, a blood clot. So in this case, a piece of dead bone. So extirpation for the sequestrectomy procedure. Now let's talk about the excision of the sinus tract. Well, many of you may not be familiar with the term sinus tract. So again, we need to go look something up if we don't know what it means. But a sinus tract just means a tunneling wound or a passageway under the skin through soft tissue that creates a dead space where an infection can develop. So they want to cut that out, an excision. So here they're excising that dead space. So this actually makes it pretty easy. We'll go ahead to that root operation of excision. So our final coding paths for these two procedures, again, our sequestrectomy will be coded to the root operation of extirpation of the femur lower. How do we know it's lower? Again, we have to make another decision here. Again, referring back to our medical terminology. Distal. What does distal mean? Remember we had those terms distal and proximal. Proximal meaning closer, and distal meaning further away from the core of the body. So now we know it's the lower part or the distal part of the femur because it's documented right here. And we have this left side documented. So this leads us to code 0QCC3ZZ. Then we'll follow a similar path for the excision of the sinus tract, which again is within that left distal femur. So excision, femur, lower left, 0QBC3ZZ. As usual, thanks for joining me with the video this week. Happy coding!